Hey everyone, and welcome to This Explainer. Today, we're going to completely change the way you look at a hospital. We're stepping right through the double doors to demystify the meticulously engineered world of the operating room. We always focus on the incredible skills of the surgeons and nurses, right? But today, we're looking at the room itself. Because every single detail in this space, from the paint on the walls to the little wheels on the tables, is specifically designed to save lives.
Think about this for a second. Have you ever actually wondered why operating rooms look the exact way they do? Why are they always that very specific pastel color? Why is it always so cold in there? Why do the doors look like that? Well, as it turns out, absolutely nothing in hospital architecture is there by accident. It's all a highly calculated choice to prevent infection, maximize efficiency, and keep both the patient and the surgical team completely safe.
So, here's our roadmap for today. We're going macro to micro. We'll start with the blueprint for surgery, navigate the 3 zones, look at constructing the perfect room, dive into climate and hazard control, detail the essential furniture and equipment, and finally wrap up with our ultimate takeaway.
All right, let's jump right into Section 1, the blueprint for surgery.
Now, what's really fascinating about the strategic placement of the entire suite is that it's designed almost like a fortress. It has to be centrally located so elevators are easily reached for patient transport, and it needs to be right next to support services like X-rays, the lab, and the pharmacy, just to avoid any critical delays. But at the same time, it's intentionally placed in a cul-de-sac, meaning a passage with only one outlet, or it's situated far away from heavy hospital traffic. This isolation isn't just about cleanliness, it's absolutely crucial to prevent annoyance, anxiety, and disturbance to the patients.
When architects sit down to calculate the size of these suites, they're looking at several vital metrics. They factor in the operative load, so how many cases are done per day, and the frequency of emergencies. But the physical size of the individual rooms is heavily dictated by the type of surgery happening inside. For example, open heart surgery requires massive, bulky equipment like machines that literally pump and oxygenate blood outside of the body. To conserve time and avoid overcrowding, rooms are often arranged in pairs, which lets them efficiently share scrub and sterilizing facilities right between them.
Moving right along to Section 2, navigating the 3 zones.
The operating suite is actually divided into 3 distinct zones. Think of them like a series of increasingly secure airlocks. First, you have the unrestricted or clean zone. This is your entrance, the changing rooms, and the visitor's waiting area. Next, you step into the semi-restricted or substerile zone. This includes the patient's waiting room, the recovery room, and, crucially, the scrub areas. Finally, you reach the absolute core, the restricted or sterile zone. This is the actual operating room and the sterilizing rooms. You can't just wander from the unrestricted zone into the sterile zone without following some very strict protocols.
Next up, Section 3, constructing the perfect room.
There's been a massive evolution in medical architecture here. You know those classic white tiles you see in vintage movie hospitals? Yeah, modern hospitals completely abandon them. Why? Because the plaster right between those tiles is porous, which makes it an absolute trap for dangerous bacteria. Modern ORs instead use completely sealed paneling materials and flexible wall coverings. These seamless walls can totally handle being scrubbed down with harsh bactericidal chemicals. Plus, they're painted in washable pastel colors, mostly because stark white actually causes severe eye strain and glare for surgeons who are staring at bright lights for hours on end.
So the room itself is literally fighting contamination and hazards. The edges and corners where the floor meets the wall are actually rounded off, meaning no sharp 90-degree angles where dust can easily accumulate. Cabinets are recessed directly into the walls with sliding doors to space and maintain asepsis. The door frames are huge, a minimum of 5 feet wide, so you can safely maneuver beds and equipment. But the craziest feature? The floors themselves are impregnated with conductive material. This creates a pathway for electricity to be conducted away from personnel and equipment, preventing the dangerous buildup of electrostatic charges.
And get this, here's a really surprising fact about those heavy doors. Even though the rooms are equipped with double-acting swinging doors that have rubberized guards and little windows, using them is heavily restricted. Our source notes that the physical action of swinging a door produces air turbulence. That turbulence kicks up microscopic particles, instantly increasing the bacteria count in the air. So, during a procedure, movement through those doors is kept to an absolute minimum.
All right, Section 4, climate and hazard control.
If you've ever stepped into an operating room, you know it feels very specific. The temperature is strictly regulated between 72 and 78 degrees Fahrenheit.
It's maintained by powerful air conditioning systems designed not just for comfort, but to constantly pump in a fresh supply of filtered air that is entirely free of dust particles.
But it's the humidity metric that's honestly the most shocking. It has to be maintained exactly between 55 and 60%. If it drops too low, static electricity can build up. And when you're in a room where highly flammable anesthetic agents are being used, a single electrostatic spark can literally cause a lethal explosion. No joke. The climate control here is a literal life or death metric.
To add another layer of protection, the physical airflow is heavily engineered. Ventilation systems are calibrated so that air pressure pushes outward from the cleanest area. It flows from the sterile zone out to the substerile zone and finally out to the clean zone. So if a door does happen to open, the clean air pushes outward, making sure no contaminated air from the hallways ever blows into the surgical space.
And you obviously can't afford to lose power in the middle of a procedure. The utilities in this room are built on extreme redundancy. The main operating fixture gives off shadow-free lighting with minimal heat. Crucially, the ceiling lights and the operating lights are wired on entirely different circuits, so if a fuse blows, the surgeon isn't suddenly left in the dark. There are also continuously tested storage battery lights for power failures, emergency signal lights that the anesthetist can easily grab, and flush-mounted connections for specialized equipment like heart-lung machines.
Zooming in even further, Section 5, Essential Furniture and Equipment.
The furniture inside an OR is just a completely different breed from the rest of the hospital. With very few exceptions, modern OR equipment is made of unpainted, easily cleaned, corrosion-resistant metal, or CRM. The operating table itself is this highly complicated hydraulic system that locks rigidly into place but can be adjusted for literally any surgical angle. And remember that explosive static electricity we talked about earlier? To prevent it, virtually every piece of furniture from the tables to the adjustable Mayo stands overhanging the patient rolls on specialized casters. These wheels are made of conductive metal or rubber to quietly ground electrical charges into that engineered conductive floor.
Speaking of electricity, our source gives a very intense, specific medical warning about electrosurgical tools. These are tools that use electrical current to cut tissue or stop bleeding. Before use, the inactive electrode has to be covered with a proper electrocardiograph contact paste to safely pass the electricity. The strict warning here is to never, ever use a standard lubricant like KY jelly. Because it's non-electrolytic, it actually insulates the electrical contact. This forces the current to concentrate and push through thin portions of the jelly, which will cause severe, localized burns to the patient.
Setting up equipment like that electrosurgical tool requires this highly choreographed dance to make sure the sterile field is never broken. It goes like this. The circulator, who is an unsterile team member, sets up the base machine and the foot pedal. Meanwhile, the scrub nurse, who is completely sterile, inspects the sterile surgical tip and inserts it into the handle. Then, the scrub nurse carefully holds the sterile end and hands the unsterile plug cord over to the circulator. The circulator plugs it into the wall and the unit is tested. At no point do the clean and unsterile worlds collide. It's just a flawless system of checks and balances.
And finally, Section 6, the ultimate takeaway.
I really want to highlight this specific quote from our source document. Proper construction makes provision for the maximum efficiency of personnel as well as the safety of both patients and OR personnel. It perfectly encapsulates the whole philosophy of the operating theater layout. The architecture is actively participating in the surgery.
So here is the ultimate takeaway we really want you to remember from this explainer. The operating theater isn't just a room where a procedure happens. The room itself is a highly calibrated medical instrument. From the precise 55% humidity levels preventing anesthetic explosions, to the outward-pushing airflow keeping bacteria at bay, all the way to the conductive casters grounding electricity, the physical environment is just as vital to a successful surgery as the surgeon's scalpel.
Which leaves us with a pretty fascinating thought to end on today. We've seen how decades of engineering have perfected this space to handle today's procedures. But knowing how meticulously engineered these spaces are, down to the millimeter, how might future technologies like robotic surgeons, AI monitoring, or crazy new sterilization tech alter the very blueprint of the operating room in the decades to come? It's an incredible frontier. Thank you so much for joining me on this explainer. I hope you found the hidden engineering of the operating room as fascinating as I do.